Hi, my name is Dr. Louisa and I make child health education videos. Today we're going to talk about constipation. In particular, constipation in toddlers and focused on dietary causes of constipation. We define constipation as infrequent, hard stools, and it may be associated with straining on passing stool and pain on passing stool. This often happens because of diets that are very high in refined foods, and a lot of commercially produced weaning foods tend to be very highly refined and very low in fiber and predisposed to constipation. This is in direct opposition to our usual traditional foods, such as small round grains that can be used to make a meal and subsequently turned into a porridge. These would have a very high fiber content. Parents will come in after a few episodes of these painful stools and ask for a solution. They've often gone to find over-the-counter remedies in order to allow the child to pass stool. Often the system is very backed up, and as a result of this, just using a single, dose of over-the-counter medicine is going to give relief for a very short period of time, but symptoms often recur. The other knee-jerk reaction that we will often have as families of a toddler who has constipation is to immediately increase the amount of fiber that the child is receiving without actually managing the backlog of the stool that is within the system. And what that simply does is to add more to the back of the backlog, basically, and worsen the constipation. The other home remedy that families will often use is to increase the amount or other liquids that the child is given. And this can be useful because it allows the stool to become a little bit softer. But again, if there's been backlog, it doesn't solve the issue. If we've had a recurrence of constipation, it's important to see their family practitioner so that the child can be assessed to make sure that there are no other complications that are causing this recurrent constipation, and also to ensure that appropriate treatment is instituted for an adequate amount of time in order to decongest the bowel and allow the bowel to start functioning properly. Treatment periods can be from 10 days to 2 weeks and may often need to be repeated.